Hi guys, so in this video let's talk about chronic fatigue syndrome. Chronic fatigue syndrome is also called myalgic encephalomyelitis. So don't go with the name, it is not as bad as it sounds. It's just normal fatigue, alright? The patient has normal muscle weakness, alright? So for this condition, first of all, it is a chronic disease, chronic condition, and it is usually a diagnosis of exclusion. So you'll first exclude the other options, and if nothing else seems to be right, only then this will be the right answer. Alright. So for chronic fatigue syndrome, just imagine a female patient, usually a female patient, or maybe somebody who works or somebody who, who is in a lot of stress. Just imagine an anxious female patient or anxious patient or a depressed patient. Alright, these are the features of this condition. So the patient is usually stressed due to something, and because of that she feels like she's getting tired at the end of the day, or during doing some activity, and she's having activity induced muscle fatigue, cognitive dysfunction. She thinks that she's losing all her memory and all. She's having sleep problems, insomnia, and she's having generalized pain or weakness is better. All right. And for this the management will be treating the depression, treat her depression, treat her anxiety, and the patient will be fine. She'll start doing much better. So for depression, always the first line treatment will be cognitive behavioral therapy, right? So CBT is the first line treatment, and secondly you send her to exercise programs or something to make her feel like, if she's doing more exercise she'll feel better, right? Lifestyle changes. And tricyclic antidepressants like amitriptyline. One differential diagnosis that we have to know for chronic fatigue syndrome is fibromyalgia. So for chronic fatigue syndrome, the patient will complain of fatigue more than pain, okay? Because it's in the name itself. F means fatigue, right? So she'll have more fatigue than pain, whereas in fibromyalgia, it's not polymyalgia, I'm sorry, it's fibromyalgia. In fibromyalgia, the patient will have more pain compared to fatigue. So even here the patient will have fatigue, but then the pain is much more severe. The pain will be more in fibromyalgia. So that is the main differential diagnosis of chronic fatigue syndrome.